Everyone, it's 12 o'clock. I think we can begin our webinar. So a very good afternoon to everyone. My name is Natalie Garino and I work with Infiniti of Arabian Automobiles. I would like to officially welcome everyone to the Infiniti of Arabian Automobiles company and King's College Hospital Dubai webinar. I really want to thank you all for joining us. I know, a lot of you, that we all busy, have busy schedule, but this is really to give you a bit of an idea. For us, breast cancer awareness at Infiniti is something very important. We've been doing a lot of action and trying to raise awareness every year for the past couple of years around breast cancer awareness, so that promoting the early detection and the importance of self-examination. So for this year, obviously, with the COVID-19 pandemic, we decided to do a webinar, and we joined forces with one of King's College Hospital Dubai's oncologists to basically conduct an online webinar to shed some light on the breast cancer awareness. So I'd like to welcome Dr. Marlene Mubarak, who is a very well-known obstetrician and gynecologist. I believe she created first patient endometriosis. I hope I can pronounce this well, as a support group in the United Arab Emirates. And I believe, Doctor, you were awarded the Government of Dubai Health Award as Distinguished Physician in 2019 for outstanding accomplishment to health services. So Dr. Mubarak will basically be discussing breast cancer prevention, control, detection, diagnosis, and self-examination techniques. So Dr. Mubarak, thank you very much for hosting this session, and I would like to officially welcome you. And I hope all the viewers here will enjoy and listen to what you have to say. And I believe if we have any questions, we can ask them maybe in the chat box, and I'm sure you'll be able to answer these questions. So thank you so much, Dr. Mubarak, and over to you.
Thank you very much. Good morning, everybody, and thank you for Infiniti for this, important opportunity to talk about breast cancer and breast cancer awareness, because it's a very important topic. I was the head of gynae cancer in the UK, and I was actually in charge of the screening program in the UK, which is well known for breast cancer and cervical cancer screening because it saves life. And my other special interest is endometriosis, advanced laparoscopic surgery for severe endometriosis, and patient education. That is something very, close to my heart. So I'm trying to get the presentation work. It's not my computer. Get the slide down. So why do we have every October? Sorry, just technical problems with the slide. I'll carry on talking. So why every October is regarded as breast cancer awareness? The reason for that, breast cancer is a serious disease. It's the second most common cancer in women after skin cancer. Even in some cases, or most cases, it can be cured. However, the treatment is really difficult, affects the quality of life, and is quite long. It's really for lifetime. However, 20% of women with breast cancer, lose the battle with the disease. How common it is? What do we know about it? Why it's important? 1 in 8 women will have breast cancer in their lifetime. But men can have breast cancer. The incidence is less. 1 in 1,000 men can have breast cancer. In every 100 breast cancer cases, we have 1 man and 99 women. So always important. So what is breast cancer? Cancer is a type of cells that grows uncontrollably. The breast contains areoles where the milk is produced, the ducts where the milk is passed through the nipples for the baby to feed if a woman is breastfeeding after delivery. The cancer can develop in any part of the breast, including the muscles of the breast. It can spread. It spreads through the blood vessels and it spreads through the lymph nodes. The most common site of spread of the breast cancer is actually liver, the lungs, and the bones, and mainly the spine, and some cases into the brain and other parts of the body, including the pelvis and the ovaries. So it's a metastatic disease. Saved your loved one. Why? Screen. Why do we need to screen? Cancer is the second leading cause of death in the United States after heart disease. 1 in every 4 deaths in the USA is due to cancer. 250,000 of women per year get breast cancer. Unfortunately, 42,000 women per year in the USA lose the battle with breast cancer and they lose their life. It's more common in women above the age of 50, but quarter of the women are actually young. 2.9 million women are cancer survival in the USA. If we pick it early, the chances of the cure is 98%, and that's why it's important to screen. That's why it's important to be aware of. If we look at the USA data, out of 100,000 women, breast cancer is on the top of the list of the new cancer diagnosis. If we look at the number of deaths of all cancer, it comes as number 2 after lung cancer. It's a very common and it's a very fatal disease. So there are different types of breast cancer, and the best time to pick it up early. What we call ductal carcinoma in situ, as the cancer is in the ducts of the breast, just inside the lining, and that's the earliest stage. That's the best time to pick it up. Later on, it can spread to the lobulars of the breast, and it can spread to the ducts, and we call it invasive ductal carcinoma. There are different types of breast cancer, like as Behçet disease, but the invasive ductal and invasive lobular carcinoma are the most common. There are 7 key pieces of information, I'm sure you heard about them and you didn't really understand what does that mean. When we look at cancer stage, we use something called TNM. We look at the size of the cancer, we call it tumor size. The N stands for the lymph nodes, the number of the lymph nodes involved and whether they are involved or not. So if there's no lymph node involvement, we call it N0. M, which is at a later stage when the disease had spread to other parts of the body, and that's the M. Also, breast cancer is hormonal dependent in most of the cases. When we look at the biopsy of a breast cancer, we look whether they have receptor for estrogen, progesterone, and another hormone called HER2. What are the receptors? Basically, you have the receptor that's like the one. If the hormone becomes attached to it, then it works. The hormones on its own, it doesn't function until it's attached to the receptor. And this is why we look at the presence of hormonal receptor, because it helps us in modifying the treatment for the cancer, the type of treatment, the length of it, and a lot of factors, and as well the outcome. So What are the symptoms of breast cancer? Remember, a lot of the women don't have any symptoms, and that's why we need to screen. The things that you look for is a new lump in the breast or a lump that you knew it existed, but it increased in the size. You notice there is some thickening in the breast skin. It changed in color. There is some like dimpling, and basically what is dimpling is like the tumor under the skin had pulled the skin to the inside, and it looks like the skin of a really old person on the top, and that is a really strong sign associated with cancer. Unfortunately, it's a bit of a late sign. Redness or flakiness of nipple, the nipple retracting to the inside, nipple discharge. So many women come to me and say, oh, I have breast milk, I'm worried. No, breast milk discharge even in non-pregnant and non-breastfeeding women is normal. We are talking about yellowish, darkish, dirty type discharge. That's what we are talking about. The change in size of breast, all of us have one breast bigger than the other. That's natural. However, suddenly you notice there is changes in the size. Pain, it's a common. So all these symptoms can be associated with breast cancer, but actually a lot of the time have nothing to do with breast cancer. It can be just related to infection or a bruise from a trauma. But if you have any of these symptoms, you really need to be checked up. So what are the risk factors? There are risk factors that we can change, and there are risk factors that we can't change. So lifestyle changes. So our weight, so obesity is a risk factor, being physically inactive, medical diseases such as diabetes, smoking is a significant risk factor, taking hormones such as hormone replacement therapy or oral contraceptive pill. However, having these risk factors does not mean you will develop the disease. I'm just going to talk a little bit about hormone replacement therapy or the oral contraceptive pill. We need to put things into perspective. You might have read in the newspaper a few years ago, they said if you take HRT, your risk of developing breast cancer goes up by 37%. The facts are 37 out of 10,000 women will develop breast cancer in their lifetime. If they take the hormone replacement therapy for 5 years, that goes up to 42. So it's extra 5 women in 10,000. If they use it for 10 years, that goes up to 42 to 47 in 10,000. The numbers is really small. And when a doctor decides whether to give you or not to give you, we put in balance, we weigh the benefits and the risks. We do a risk assessment. We check for family history, personal history, and then we decide with our patient whether to give them the hormone replacement therapy or not. Some women will not even stop it. They are aware of the risk. They can't cope. They can manage with the hot flushes, the night sweats, the mood swings. They would rather be on HRT. The contraceptive pill, the same. The risk is really small. The risk goes up after the age of 39. In the UK, we stopped giving the contraceptive pill. We switched to progesterone-only pill or alternative contraception after the age of 39 because of the increased risk. But the contraceptive pill have advantages. One thing that nobody have ever told you, and I'm sure many will say, I've never heard of that. If you take the combined contraceptive pill for a total of 5 years in your lifetime, that reduces the risk of cancer of the ovaries, which is another killer, by 50%. Cancer of the uterus and the lining of the womb by 50%. Cancer of the bowels by 25%. So always as a doctor, we look, assess for risk and do a balance. So What are the risks that you can change? The more periods you have in your lifetime, the more your risk of breast cancer. What do I mean by that? Having the first period under the age of 12, period stopping after the age of 55, women who don't have children or just have one child, women who have not breastfed. So these are risk factors. We really can't control them. It's, our life. The other thing is 5% breast cancer is genetic. It's related to two genes, BRCA1 and BRCA2. What's the significance of these genes? We all know Angelina Jolie. We all love her films. And we all were shocked when we heard she had both her breasts removed and she had her ovaries removed. She had a very strong family history of breast cancer. Her mom, all her aunts, as well, she is positive for the two genes BRCA1 and BRCA2. The risk of developing breast cancer if you have the BRCA1 is 72%, and if you have BRCA2 is 69%. The background risk is only really low, like 1.2%. BRCA1 and BRCA2 are associated with the risk of ovarian cancer. So for BRCA1, the risk of ovarian cancer, lifetime risk of ovarian cancer is 44%, and BRCA2 is around 17% with a background of 1.3. So you need to know your family risk. We can test for these two genes, and then we can counsel whether we need to do anything. It's a bit radical to remove the breast and remove the ovaries, but there are things that we can do from the point of view of screening to be able to pick it early and, of course, avoid using hormonal treatment. So prolonged use of HRT, we talked about that. Women who had breast cancer, even if they have a cure, they always carry the risk of the breast cancer coming back. Having radiotherapy, whether it's for breast cancer, for Hodgkin's lymphomas, especially under the age of 30. In the past, we used to use a drug in pregnancy to reduce the morning sickness, which was banned in the 70s. And women who had been exposed inside the uterus to that drug, the ethyl estradiol, are at higher risk of developing breast cancer, but there is very few people who are still alive who have been exposed to it in utero. So how can I lower my risk? One, know your family history. Make sure you know if you have aunts, grandmother, especially we are talking about breast cancer and ovarian cancer under the age of 50, not above the age of 50. The risk is, we say you are high risk if you have one or two members of the family, first degree relative, under the age of 50 who have breast cancer. How can I change that? Exercising, healthy eating is an important factor in reducing the risk. Self-examination. That is something is important that all women, all ages, whether you have any risk factor or no, should do self-examination. How frequently? Monthly basis, immediately after your period. Ideally, day 5, day 6 after the period. Because before the period or during the period, we will have hormonal changes in the breast. There's always some lumps, tenderness, changes in the look of the breast, and that's completely normal. So what do? The first thing you do, you stand in front of the mirror and look at your breast. You are looking to see if there is any dimples. You are looking to see if there's any changes in the color. The nipple is retracting to the inside. Then what you do, you lift up your arms behind your head and while you are stretching, because if there is any mass under the skin, you would know it's pulling the skin and you can have a better view of your breasts and you can see if there's any changes. The next is palpating and checking your breast. You go clockwise, left breast or right breast first, it doesn't matter, and you feel for lumps, and you will discover your breast this way. And all of us have lumps and bumps, but the lump usually, or what we call breast cysts or fibroadenoma, which are benign, they are usually mobile, they feel soft, they are non-tender, you become to know them, know their size, and if you notice any changes in their size, you need to go or you discover something here. Then you palpate under your arm to feel for lymph nodes. Just be wary if you've shaved or you remove the hair and there is infection on the follicle of the hair, you will have a lymph node under the armpit, and it's not something to panic about, but still go and be checked. So what you do, you lift up your arms without stretching it behind your back, just slightly, and just feel under your arms. And as I said, monthly basis after your period. What other measures I can take to lower my risk of breast cancer? One is screening, screening, screening. Who and when? If you have no family history of breast cancer, we start the screening at the age of 40, ideally, in the ideal world. And we do a mammogram, which is an X-ray. I will show you a bit about it in a second. Above the age of 45, whether it's the American or the British or the European system, we screen every woman on a yearly basis, and we do a mammogram. Once you reach of the age of 55, if all your mammograms are negative and there's no family history, there's no risk factor, we can switch to yearly mammogram. Under the age of 40, if there is any suspicions of family history, we do breast ultrasound because the mammogram does not really give us a very clear idea. Other things you can do, reduce the amount of the alcohol you drink. If you don't need to take hormonal replacement therapy as HRT, or you've taken 5 years of it, and you can, feeling fine to switch and stop it, then that's it. Breastfeeding, we really have to emphasize on that. Women who breastfeed, especially more than 6 months, they reduce significantly the risk of breast cancer, as well as the benefit to their babies. So, mammogram. What is mammogram? Mammogram is an X-ray, and I'm sure many of you who had it, you think, oh, it's painful, but it saves lives. It's simple, it doesn't take long. We take an X-ray of the breast. It gives us a panoramic view of the breast, and I put some pictures here to show. And you can see here in this yellow circle, we saw a shadow. So basically mammogram, the way I describe it, is like, a plane flying over a city and doing a survey, and that's what is mammogram. To look in further details, we do ultrasound. So if the mammogram saying like there is dense breast, I can't see, we do breast ultrasound. It gives us a little bit more accurate information. So if we look at the first picture here, this is a mammogram, and we've seen a nodule. It just shows there is something. I want to investigate further, I will do ultrasound. And you can see it looks like it has roots to it. And that's how a suspicious lump in the breast will look on ultrasound. But we always have cysts in our breast. It's really common. So if you see here on the side, I wrote a word called BIRAD, B-I-R-A-D. This is a scoring system, which you will see on your breast ultrasound or mammogram report. What does that mean? BRAD 0, it means we couldn't see. And usually we will see that on mammogram, and then we do ultrasound because to be able to see better. BRAD 1 and 2, that's normal. 3, oh, I don't like that, I'm not sure, we need to check further. 4 is highly suspicious. So this lady have a cyst on the breast. It's black, rounded, nice, and it's coded as BRAD 2. This is a fibroma. This is a mammogram for a fibroma. It shows as white. If I look at it closely with ultrasound, I can see it's smooth, regular. This is a fibroma on the last picture at the bottom left side of the screen. I see it's a bit irregular. It's a bit lumpy. And we gave this a BRAD 4. This is suspicious. If we don't like what we see, what is the next? How do we establish diagnosis? It's something called fine needle biopsy. It's not frightening. It's not as bad as it sounds. It's like going to the lab and having a blood test taken. It's under ultrasound. It's a fine needle. The radiologist will hold the ultrasound probe. We put a lot of local infiltration, like when you go to the dentist. And then we take a tiny weeny biopsy, which we check under the microscope in the lab. It gives us a very good idea what we are dealing with. And most of the time, it's benign. And we say, just come back and repeat the ultrasound after 1 year, and nothing more than that. Something I've noticed in this country, which I've never seen in the UK, is that when I say to a woman, your ultrasound is BRAD 4, you need a biopsy, they will panic and say, no, the biopsy will make this cancer spread. Maybe that in the old days, when we had no treatment for cancer, once we diagnose cancer, people don't survive for long because we've already picked it up late. Taking a biopsy does not allow the cancer to spread. It never spreads from taking a biopsy. Biopsy is really essential. So we talked about progesterone estrogen receptor, and this is what I was describing. In a normal cell, we will have 1 or 2 receptors, just a little bit for progesterone and estrogen. And that's why, many of us will feel their breasts growing in size before their period, becoming a bit tender, unpleasant. It's because of the presence of the estrogen progesterone receptor, which is really healthy and normal. In breast cancer, the number of the receptors is increased. And that's what we look for when we do the biopsy. We check for the receptor. So, treatment. How do I treat breast cancer? We look at many factors before we decide. We look at whether it reached the lymph node, whether it's any other place in the body, the age of the woman. We look at whether it's how aggressive it is. That's something I didn't talk about. So I'm sure you've heard grade 1, grade 2, grade 3, or in other words, we say well differentiated, moderately differentiated, or poorly differentiated. What we are looking at, how much the cancer cell still looks or resembles the original cell. The more it changes, the more aggressive the cancer is, and that's the poorly differentiated. And that's something we take into consideration when we do the treatment. The most common treatment for cancer now, we don't do as many breasts, removing the whole breast or what we call mastectomy. We normally remove the lump itself with a nice margin of clearance with no disease in it. We remove the lymph nodes. We are pretty good at breast construction. We put even implants at the same time, so the woman wouldn't even notice, and nobody would notice that she had surgery for cancer. And that is something to be aware of. Our breast cancer surgeon, and we have an amazing surgeon here in Kings. She is so good. You will barely notice the scar. And these are things we consider because our breast is part of who we are. So all women nearly will have radiotherapy and will have either chemotherapy or hormonal therapy. It depends on the presence of these receptors or hormonal receptors. So the most common hormonal treatment we use is tamoxifen. It's good to talk about that. Tamoxifen is we use actually to induce ovulation in women who are unable to get pregnant because they have PCOS, polycystic ovarian syndrome. We use it for estrogen and progesterone receptor positive breast cancer. We used to use it for 5 years. It reduces the chances of the cancer coming back. Recent studies showed it can reduce the risk of breast cancer in high-risk women. As well, using it for 10 years is more beneficial than just 5 years to reduce the risk of breast cancer. And of course, I mean, sadly, in some cases, we'll have to use chemotherapy if they are, especially their cancer is non-hormonal related. The chemotherapy can cause hair loss. And we've seen many celebrities shaving their heads because the chemotherapy causes hair loss while you are taking it, and the hair grows back completely again. So these are, in brief, you know, what we do for cancer. A lot of us now, or even, you know, in Europe, we are moving toward complementary or alternative medicine. There is a role of it. It can't replace actually, you know, the medicine or what we know. There is a role for complementary and alternative medicine in adjacent to the classical treatments that are proven, you know, for cancer treatment. You know, what are the alternative medicine? Why they are important? Chemotherapy, surgery. It affects our energy. It affects how we feel about ourselves, our mood. So things like yoga, it improves our mood. It makes us relax. Stress affects cancer. You know, when you exercise, you improve your mood. You improve your belief that you will have a cure. You improve your well-being sensation. That really helps in the treatment of cancer and surviving it. People who believe they will get over it, they do get over it. People who doom and gloom and they feel very negative, they have a tough journey and they might not survive. So whether you do a massage, acupuncture is brilliant for pain. And as well, if you are taking chemotherapy, some experts in acupuncture can help. Green tea, eating seeds, garlic, broccoli, taking multivitamins, but definitely there is no alternative to a healthy, balanced diet full of colors that cheers you up when you look at your plate. And it gives you all the nutrients, vitamins, and the minerals that you need. So the last message is steam. What is steam? Tell everybody about mammogram. It saves life. If you are under the age of 40 and you are worried, you felt something, go and see your gynecologist or your breast surgeon. They will do a simple breast ultrasound. It's the most accurate and the most sensitive, and you will have more information. Spread the word. Tell everybody, make sure everybody gets screened. And that's the main message. Thank you very much, and I'm open for a question now. I'm just going to ask my colleague to help me with it.
Yes, so everyone, if you have any questions, please, happy to take your questions. Don't be shy.
There is a question here. Is it true that also men can get breast cancer?
100%. I actually personally know a couple of men. One of them is 25 and the other young man is 60. Both had breast cancer. Nobody believed, and the young 25, he completely ignored it. It's until his dad told him he had breast cancer himself. Unfortunately, sometimes we hide from our kids that we have serious diseases. He was checked out and would discover that he had cancer. So out of 100 people who have breast cancer, 99 are women and 1 is a man. So yes, breast cancer can be in men.
Another question, doctor. May the following increase the risks: breast implants and bigger breasts, bigger cells and more risk?
So bigger breast does not, if you have big breasts, we are born like that, you are not higher risk of actually having breast cancer. It just makes the screening a little bit more difficult. So you need a good radiologist to have a good mammogram, the quality of the mammogram, breast ultrasound. Breast implants, I mean, there is a debate about that. Breast implants can make it a bit more difficult to do the breast screening and the self-examination. There is certain type of breast implant which there was a scandal in the UK a couple of years ago. There was a breast implant that was used and it leaked because the quality of it was very poor and the material inside the implant was carcinogenic, and they started removing it from the breast a couple of years ago, or actually more than that, 5 years when I was in the UK. I've been in Dubai for the last 3 years. So I would say if you need a breast implant, go for it, but ask your surgeons really questions about what they are using and how well it's been tested.
Another question, if you've gotten fibroadenoma and removed it twice within a span of 3 years, are you at risk for cancer?
Fibroadenomas are benign. I think, yes, I'm a surgeon, but I'm conservative. We don't really remove fibroadenomas unless we think they are suspicious. Sometimes certain things are better left untouched. If they grow rapidly or they are causing pain, pressure, definitely. But please go to a very good, reputable breast surgeon before you start having surgeries.
A question, depending on the stage, how quickly do I need to make a decision to start treatment?
Go to the experts and follow what they advise. Ask questions. We are, in the UK, we advise people to ask their surgeon how many cases you've done, what's your outcome, what is the alternative treatments, what is the success rate. So ask all the questions, but follow the advice of the oncologist. That's the best advice.
That's it for now. We don't have any other questions. One more. I would like to ask a question. How often should one do a breast check, and is checking often has any side effects?
Don't panic from checking often, but don't get obsessed. Monthly basis, immediately after your period, check your breast. This way you become to know your breast. You would know every tiny weeny lump and bump in your breast. But don't panic. Yes, 1 in 8 women develop breast cancer. 75% of them after the age of 50. That's why we do screening after the age of 40. But yeah, do monthly breast check.
You said that there is a possibility that the next genes...
Sorry about that.
You said that there is a possibility that the next genes might also get a cancer if the mother has ovarian cancer. How is it actually transferred? Is it because she undergone a C-section during birth?
No. So 5, 5% of cancers are actually genetic. Even if your mom had ovarian or breast cancer, doesn't mean you are at risk of ovarian or breast cancer. We are talking about ovarian or breast cancer under the age of 50. Genes, it means the genes are what is responsible for us having blue eyes, having dark hair. It's something we are born with, we inherit from our parents. It's only 4% of the population have the BRCA1 and the BRCA2 genes, so it's not really that common. So the risk is related to people developing cancer under the age of 40, the 50, whether it's ovarian or breast, and we can check for these genes.
If a person has benign cysts in their breasts, is it possible for it to develop into breast cancer?
Simple cysts, which I showed you a picture of, they never develop into anything whatsoever. But if, I have a lot of young ladies who have so many cysts in their breasts. These are the ones that I would say to them, have a breast ultrasound on a yearly basis. It's simple, it's not painful, and always keep the report. That's something else. That's, in the UK or Europe, all your file is there with your family doctor. It's there in the hospital that you go to. Even if you move place, it follows you. Here in the Middle East, that doesn't happen. Make sure you take a copy of the CD of the breast ultrasound or the mammogram and a copy of it. Create a file for yourself. When you go for your breast ultrasound or mammogram, take it with you so they can compare. Then they know actually there's no changes in the site. Don't panic.
I'm also wondering, what is the probability for a woman in their 20s to be diagnosed with breast cancer?
It's really, really small. I would say under the age of 25, most probably the incidence, out of 100 women who have breast cancer, 25 of these women will be under the age of 50. And under the age of 25, it might be 1 or 2 maximum. Really, it's not that common. We still don't ignore. If, I have young girls who are at the age of 15 came to me with a breast lump that they never had and they are frightened, or they have a family history of breast cancer. I would do breast ultrasound. It's simple.
After the age of 40 years of age, should you do a mammogram yearly?
100%. So the screening starts at the age of 45. But ideally, I would start from the age of 40. On a yearly basis, do mammogram. It's simple. It saves life. If you pick it up early, 98% you will survive. If you pick it up late, the mortality rate is anything between 20 to 75%, depend on what stage you discover it at and where it had spread. If you find it early, 98% you will be cured. That's why screening is important. That's why the whole world is spending billions of dollars on the screening programs, because it saves lives. It's cheaper than treatment. It's easier than treatment.
How do men get checked, mammogram or scan?
Men, we look for risk factors. Usually there is a family history, morbid obesity, as really high weight, heavy smokers, drink a lot of alcohol. Still, we do advise men to do the self-examination and to do breast ultrasound if there's any suspicious. As I said, the incidence in men is 1 in 10,000. In women, it's 1 in 8. So this 1 in 1,000, and in women, in 1 in 8. That's why we target screening for women, because it's more common.
That's it. We don't have any more questions. You may tell them about the mammogram offer we have.
Yeah. So every year we always, every healthcare facilities do offers to promote the screening. And King's, we've done a lot of things, including we do a mammogram offer for I think 350 dirham. You can get a mammogram. If there is anything in it, we can. If you have insurance, you can get cover for further breast ultrasound, biopsy if required. So that's one of the things we do. And one thing, as I said before, I discovered recently, we had an amazing breast surgeon. I mean, I've only started in King's for the last 2 weeks. I was heading endometriosis center in Dubai here, accredited by the British Society of Gynaecology. I still do oncology, not as much as the UK, but I'm still hot on screening. I've never ever lost the opportunity to make sure I do breast screening and cervical cancer screening. I wouldn't be doing my job if I don't make sure that all women get pap smear. That's something else. Please, look after your health, get screening, whether it's for breast and pap smear. Pap smear starts from the age of 25. It's in the UK, we do a pap smear on a 3-yearly basis. The American system for the first few years on a yearly basis until you have 3 or 4 negative smears, and after that you move to a 3-yearly basis. These screening tests saves lives. So in countries who don't have screening program, the mortality from cancer of the cervix is something like 40 to 60 or 90 per 10,000 women. So it's really high. In the UK, the mortality from cancer of the cervix is 9 per 10,000. In the Scandinavian countries, because women go for their cervical smear test, it's nearly like 2 in 10,000. So screening saves life. If you are listening to me and you've not had a cervical smear for a long time or didn't have a mammogram, go and see your gynecologist, come to us. We are more than happy to do these tests for you. Don't ignore your health. Do the screening.
Thank you so much. Thank you, Dr. Mubarak. Do you have anything to add? Sorry, I thought you might want to say something else.
No, that's it. Thank you very much for Infiniti for this amazing opportunity. If you want to email me, you can find my email on the website. So if you want to have any other questions to ask, please, please email us. We are more than happy to respond to all your questions. And I hope you found this helpful for you, and thank you again.
It was a wonderful session. Thank you so much. I think what we'll do with Infiniti and our PubliNet team is probably do a post with all your details and your generous offer to do a mammogram. So I would like to formally thank you, Dr. Mubarak, for such an informative session. And I learned a lot, so thank you for that. I want to thank the entire PubliNet team for organizing this. And obviously all the attendees for coming. I know everybody's super busy, but that was a fantastic, fantastic webinar. So thank you so much, everyone, and wishing you a wonderful day. And stay safe.
You're welcome. Thank you.